home, not knowing they've got COVID. What's the problem there? Is there still shame with testing positive? Is there pressure to still go to work? What's going on there?
Look, there have been a number of people die at home who have never even come to the attention of New South Wales Health, or in some cases not even to a GP. And certainly in parts of Sydney, particularly in the southwest and west, I think there's a lot of pressure. This is a disease that's highlighting some of the, or it's a virus that's highlighting some of the inequities in our community. And in some households, it can be a very large household where only one or two people are working. And I think there is a reluctance in many instances for people to want to actually tell us that they're actually not well because they want to go on earning income. I just say to those people, look, the federal government and the state government have put up economic packages. There's also lots of other support for you. And the most important thing is to stay alive. So please don't hesitate to contact our health system for support. I know, again, I was just up in Wilcannia and Brewarrina and Burke and some of those areas, and what I was seeing there, and Dubbo, what I was seeing there was enormous support, even in the most remote parts of our state, for the communities who are having positive cases. Community members who've come together to provide food parcels and packages. That all is available in Sydney as well. Please, 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 don't run the risk of dying. Seek medical help.
How prevalent?
Sorry, Chris, I'll just do this, then I'll come back to you. Sure.
You're talking there about people who are kind of getting into the system too late and you know, declining and dying. Are there also people in the hospital at home system that are already at home and that are dying? And does the government need to kind of reassess its threshold for when those people are brought into actual hospital because of how quickly they're declining? Look,
there's no hesitation in bringing people into hospital who need to come into hospital. I think the issue is, as we've said right from the word go, and has been said worldwide, that this virus, contrary to what some people say, is an extremely dangerous virus. We have seen people who in the morning are quite well while they're in hospital and deteriorate very quickly and be on a ventilator or in the ICU. So I guess what I would say to people who are at home is don't hesitate. If you're feeling like, and a lot of people want to stay at home, that's the other thing, you shouldn't misunderstand that. A lot of people do not want to go into hospital, they want to stay home. And so those people just need to know that we have a world-class health system there for you. If you are deteriorating, if you're feeling like your breathing's getting worse, please contact the health system and make sure you come into hospital.
Are you comfortable with the level of care people are receiving at home? I've got the necessary equipment and everything available, blood, oxygen monitoring.
Each of the local health districts are doing an incredible job. Lots of staff managing those issues. We have obviously people who, there's a transition as well. You can be at home, or in some situations you can also go into one of our health hotels. I think we have nearly about 900 people at the moment being managed in special health accommodation. So there are a range of options. But quite often what we're hearing is that people don't want to leave their family. In earlier parts of the viral outbreak, this particular round, we had larger families often going into the health hotels, special health accommodation. But what we're now finding is that they tend to be individuals. So people are becoming more aware of the situation, but there are still people who, for whatever reason, want to stay at home. I'm quite confident that our health system is by far probably the best in the world. And people are being managed as appropriately as possible, but there will be, in a pandemic, 100-year pandemic, there will be issues from time to time where, for a variety of reasons, including the fact that people just don't tell us, that yes, they can sadly pass away.